Welcome to Beyond Adjustments, the podcast where we dive into the spine-tingling world of chiropractic care. And today, we're taking it up a notch, straight to the gut. I'm your host, Amin Saeed, and if you've ever wondered whether your brain or your gut calls the shots, buckle up. Oh, and spoiler alert, they're both in charge. And Dr. Noah Segal is here to explain why. Welcome, Doctor. Dr. Segal's journey is like a Netflix documentary meets a health masterclass. From stocking shelves in his parents' health food store to hiking through Amazon rainforest to study plants like the legendary dragon's blood ficus. Yes, it's a real thing. He's got stories and solutions for your health. We're talking the gut-brain connection. We're talking functional care, personalized treatments, and even some juicy business advice for healthcare professionals. So if you're here for tips on living healthier, smarter, or just to hear about someone cooler than the both of us, stick around. Let's get into it. Cue the music. Dr. Noah Segal. My friend from the first minute we started chatting, I just felt like we had this connection, man, and I could not wait to get you on the show. Welcome to the show.
Thank you so much. The feeling is mutual. I really appreciate the opportunity, and thank you for all you do.
Yes, sir. Yes, sir. Thank you. All right, before we get into like the crazy stuff, like the whole dragon thing, I want to talk a little bit about your early influences and your career journey a little bit. So your journey started off behind the counter of your parents' health food store, and which, first of all, I say that's cool. Why? Because I used to go into health food stores back in my neighborhood in Park Slope in Brooklyn, New York, back in the day.
Oh, sure.
Oh yeah, and I used to see some things, and I'm like, I don't know if this is allowed to be on a shelf. So I'm sure you've seen some things.
Oh, yeah.
So what lessons? Why don't you tell us? Just tell us some lessons that you learned from those early experiences that really shaped your career in healthcare.
Yeah, absolutely. So, I was young enough to start behind the juice bar. So I started off behind the juice bar, and I really enjoyed the interaction with the public. And as I got older, of course, yes, I was behind the register and with the shelving and the products and the inventory. And yeah, anything from when ephedra, was taken away, or when guaifenesin was taken away to become Mucinex. So yes, I've been around these products. I remember when ashwagandha first came, and my mom was like, there's this new herb from Ayurveda, from India, called ashwagandha. You want to try it with me, and we'll close the store? And I was like, sure. And I'll never forget that night. My mom and I, we just were very relaxed, listening to probably
Bob. The store.
Well, not close the store, but it was closing time.
We don't want anybody to see what we're doing right now.
No, just meaning it was closing time.
I'm kidding. Yeah.
So just relax, finish the inventory stock, fronting the shelves is always important. But
sure.
I think, what I really brought into, the healthcare scene or into my practice, is that idea of customer service, really. And so, we were a mom and pop shop. We were, a small family business. And my parents instilled in me that everybody matters. And, to a degree, right, the customer's always right. And just, it matters. You don't, it's not a big corporation propped up by, hedge funding. It was a small mom and pop shop. And I treat my patients, I treat my practice the same. It's a different business for sure. It's, a little different, but the customer service aspect, I think, is something that is really important, that has been instilled in me. I continue to always, have that front and center. And it actually followed me through to my training in when I was getting my doctorate, because I was at a chiropractic school, which really had evidence-based medicine as one of the tenets, or the philosophy, if you will. I don't love the philosophy of the training included evidence-based medicine, and evidence-based medicine means you take what the evidence says, what the anecdotal experience of the doctor is, and also what the patient's beliefs or wants or needs are. And that's customer service. And I just, that's really important. I think that's a game changer. People are very, they get frustrated. I'm sure you've experienced it, or maybe your listeners or have felt this, that the doctor's not listening. I'm just a number. The doctor's not listening. It doesn't matter. To only spend 3 minutes with me. So the customer service is really, I feel, and my patients, I think, respond the same. They tell me they're very happy with how I treat them. And I think that's what
awesome.
came forward with me.
That's awesome. So that journey took you down a path that, maybe you knew you were going to take, but I would say, you chose chiropractic care over traditional medicine because of your experiences, right? So can you kind of walk me through, or walk us through the kind of that moment that solidified that decision for you of, okay, I'm going to take the chiropractic care route, which, again, the more non-traditional than the actual traditional medicine route?
Yeah. So, like, I'll be really honest with you, and
Yeah.
it's a bombshell question for me, because I don't know that I made like a super rational decision. I, at the time of making that decision, was going through other existential gestalt transformations in my life and in my mind and in my lifestyle and philosophy. And you know, look, I did go to chiropractors I went to there was one chiropractor in my small mountain town that I grew up in, and he
Mm.
was my primary care aside from the shelving of herbal medicine and the juice bar and homeopathics, right? That was my primary care doctor. And I mean, thank God, if I needed stitches, whatever, I went to the hospital or with the urgent care. But otherwise, I think the lifestyle really helped prevent me from needing a lot of additional care. Of course, if I needed it, it was there and I went. But I don't
Of
remember a
course.
lot of going to a GP or a PCP. I remember going to Dr. Munley, should live and be well, in Vernon, New Jersey, and that was my primary care experience. And so when it came time to sort of, I guess, make the next decision on, am I going left or right? I don't remember it being, again, like a super rational decision. It was like, I'm definitely not going to medical school. Okay, I'll go to chiropractic school. I wanted to be a doctor. Um, and I felt like that model was the one I was familiar with. And that was the one that aligned with me then and now. But the reason I say it's a bombshell question is because I think the idea of setting aside truth for efficiency is okay to serve a goal or a purpose. And I think, if I would have, if I could have a medical degree and still practice like a chiropractor, I mean, maybe I wouldn't, because there's a lot of things that go on in medical schooling. But that would enable a larger scope of practice and a larger cultural authority. And if the ultimate goal is to help as many people as possible, then that may help that goal sometimes. I don't want to have a negative approach, but
For sure.
that's something that it wasn't a super rational decision. It was like,
I
okay,
understand.
yes.
I understand. No, that makes total sense. I mentioned in our opening introduction the dragon's blood ficus. Okay. I am 1,000% sure that this is not a common ficus or term that people come across. Heck, I sure as heck had no idea what that was. But you literally traveled to the Amazon to study dragon's blood ficus. First of all, just tell us a little bit about what that is, but then how did that experience really influence your approach to your patient care, maybe even some of the problem solving that you do?
Yeah. So the trip to the Amazon was a gift for me graduating my undergraduate degree. I graduated with a BS in biology and a minor in organic chemistry. And I spent my years in college taking advanced organic chemistry classes and doing research. So I was involved in identifying previously unknown alkaloids in Nymphaea caerulea, which is Egyptian blue lotus. Okay, it's a flower that's in hieroglyphics, and it was always together with like wine, but it's not in the common knowledge base of why or what was going on there. And so the assumption was, the hypothesis was, that alcohol is a polar solvent. If I can get my hands on some of this material, I could extract it, Soxhlet extraction technique to get to fractions, and then to do nuclear magnetic resonance, to identify the molecular structure of the different alkaloids possibly present. And then so my parents thought it was an appropriate gift, right, to give me an ethnobotanical research trip with Dr. James Duke and Stephen Foster. Dr. Duke he's a blessed memory now, but He was a world-renowned ethnobotanist. He wrote, New York Times bestseller, The Green Pharmacy, and he's an expert in herbal medicine. And Stephen Foster is an expert in photography of plants. And so this was a research trip based off of those two individuals. And the focus of this particular trip was, yes, this unique ficus that's found in the Peruvian Amazonian jungle, which is a ficus tree, but when it's tapped, it has a red sap. And of course, through expeditions, Dr. Duke noticed that the locals were using it for things, mostly topical.
Okay.
And so the idea was to, present this to a small group of interested people, myself included, and, just to collect some, to meet the people, the village people who have a lot of exposure and experience with this medicine, this plant, this tree, and to bring some back. So, we did that. I mean, this is already, I don't want to even say it, but it was around 20 years ago or maybe more. And so, yeah, today, I mean, Nature's Way has it in like a liquid extract. It's not uncommon. I don't think it ever became, like CBD or like, this world, like everyone knows about it.
Yeah.
And I didn't take the research any further, but it has anti-inflammatory, antimicrobial properties. So it's really good. Like I keep some in the house for, we live in Florida. So for the mosquito bites and such, I'll put a drop on here and there.
Yeah.
But yeah, so that's kind of as far as the dragon's blood ficus took me. But problem solving, right? The Amazon experience is one of problem. If you can't solve problems, you can't go to the Amazon, because the minute you get on the plane or get off the plane, there's a whole slew of experiences that I wouldn't say problems, but look, it's a third world country. You're flying on small planes, you're going on long boats, you're dealing with a language that I'm not familiar with, and then going into the jungle, which I'd say like this. I say, when I went, I went, vaccinated for yellow fever. I stopped taking the anti-malarial medication. That's another story. But I went, outfitted, right, with my Gore-Tex and my boots, and Dr. Duke went in a t-shirt and shorts. This is 36. It was his 36th time to the jungle, and barefoot.
Okay.
And we were walking, and he'd be like, "Oh, watch out for those ants. Those are army ants. Like they'll kill you." And he's just like, just like stepping over them.
Right.
I will say that by the time we left, his legs were covered in bites. It didn't bother him. And one of the things I think that trip taught me for sure was like, if you can't go over a problem or under a problem, you just go through it.
That's good.
So
that's good. That's powerful right there. If you can't go over or under a problem, you go right through it. That's so good. That's so good. I love that, man.
I'll leave you with that.
I love that. I love that. Okay. So on my podcast, one of the things that I do is I ask these, what I normally call $1 million questions or challenge questions. So I'm going to have a few for you, right? Throughout our session, I'll challenge you a little bit. I got to tell you though, you chiropractors, man, you struggle with giving me these answers. And what I mean is just like, they become this like lecture, because it's so hard to wrap this information into one small one-liner, 2, 3-liners, because it's potent information, and I get it. So that's the challenge, and that's why it's a challenge question. Not that you can't answer it. It's that, okay, challenge question, $1 million question, whatever it is. Can you tell it to me in like a sentence or 2 or 3? So let's see how well you do. So far, not too many people do very well with it, but we'll see. Maybe Dr. Segal will blow us out of the water. No pressure whatsoever. Maybe you'll get the gold star. But challenge question for you. So if you could distill your philosophy of healthcare into one sentence, what would it be?
So I've got it, and I think I'm going to get the gold star. I've worked on this sentence. I've worked on this question, believe it or not, throughout the years, and I distilled it down to a tagline. Actually, I think it's appropriate answer. Health is a journey. Commit to it. And that is how I would distill into one sentence, my treatment philosophy. It's a journey. Commit to it.
I think that is short, sweet, and powerful. That's perfect. And yeah, you get the gold star, man. Good job. That's awesome.
Thanks.
All right, let's talk a little bit about gut health. Okay, so Now, and please correct me if I'm wrong here. I'm not the doctor, so if I say any terms that are off, or just please correct me, because I want to make sure that we're getting the right information out. So the gut microbiome, right, is often called our second brain. Could you explain to me why it's so important for our overall health, and what is a microbiome?
Yeah. All right. Okay. This is not a one sentence answer.
I'm sure it isn't.
Let's just start with the microbiome, right? So the
Okay.
microbiome in general is, there's multiple microbiomes. Females, women have a vaginal microbiome. We all have a skin microbiome. There's an oral microbiome that, really top end dentists will focus on and consider with their patients. And I focus on the intestinal microbiome. So it's one microbiome area that, of course, that's a limited approach, right? It's a biased approach, limited approach, because they're all interconnected and they all matter. But by definition, the microbiome is essentially the bacteria that live within us and the interactions they have with each other and the impact that has on the organism and the organism's interaction, right? It's a two-way street. So the two-way communication back with the bacteria to the organism and the organism to the bacteria. That would be the definition of a microbiome.
Okay.
And the second brain, should I go into it?
Yeah, please.
So first, the first brain, right? The one we all think of is the brain. So we'll just quickly go over that. I mean, we all understand the brain is highly mysterious, the brain is highly powerful, and the brain controls everything, right? So I think the idea behind the second brain could be twofold. And I don't know where we're going to end up with it, but I think that well, here's the thing. We used to say there are more bacterial cells. It's hypothesized there are more bacterial cells in our body than human cells. Some researchers say by tenfold. That's a lot more bacteria inside of us than our own, human cells. Maybe today we are approaching more of a 1-to-1 ratio, but regardless, there's a tremendous amount of bacterial cells, and those bacteria that I focus on live in the gut, the intestine, large and small, stomach, colon. And they create chemistry, and
Okay.
chemistry is information technology, right? So if we think about technology like computers, we know zeros and ones, and we know that that is a code, and then that presents itself as information and technology that impacts our world. And we talk about the genetic code. We know it's a language. We know that you and I are speaking language. So chemistry is the language of life. And the information that's within those molecular structures impact everything, all aspects of our physiology, just like the brain and the nervous system impact every single cell in the human body. And so first of all, there's a two-way street. There's a direct connection through many different pathways, but from a bacterial microbiological perspective in the brain strictly, there is either as much or more neurotransmitter activity or precursors for neurotransmitters created in that gut with those bacteria, and ultimately with that information technology, that chemistry that they produce. So maybe that's why it's called the second brain, because of the neurotransmitter activity.
Okay.
Or maybe it's because the gut controls us, or the bacteria controls us. It literally creates and interacts with our consensus consciousness. It can turn on or turn off genes, right? So if somebody has a predisposition in the genetic code for some autoimmune condition, the information technology, the chemistry that's created by the different gut bacteria will either turn on or turn off or turn on, right? Those genetic predispositions, if you will.
Yeah.
And so maybe that's why they call it the second brain. It could also be called the second heart. It could also be called the second consciousness. It could also be called the second liver, the second skin. So there's a tremendous amount of impact there.
Got it. So it's really like just like a control system, really, at the end of the day, kind of like the way your brain manages all your nerves and communication throughout the body. It kind of does the same thing.
Yeah, well, it's not separate, right? So, I mean, ultimately, the truth, if we go far enough down this rabbit hole, is there is no difference between the brain and the gut. They are directly connected. One doesn't operate without the other.
I understand now. Okay. No, that makes sense. Okay, cool. Very good. All right. Well, a great answer. Thank you for that. Very, very thorough. So I want to talk a little bit about, so we're talking gut health. Well, you have a program called, and if I get this wrong, forgive me, correct me, the path to a healthy gut, right? Is that the full name of the program?
I mean, I haven't updated my website, I guess. That is something that I do present. Oops, sorry. That
That's
is
okay.
something that I do present to the public, I guess, in a forward-facing manner on my one of my websites. These days, I've really refined it to be called the Foundation of Wellness. But yeah, I mean, it doesn't matter what you call it. I'm using DNA PCR analysis of the microbiome to to do adjustments on my patients.
Gotcha. And that's really what guides your personalized care per individual, right? How do you customize treatments for each patient?
Good question. Each patient's different, and this is a struggle of presentation or, look, if I say I'm a chiropractor, right, and market or advertise that way, people think neck pain, back pain. Okay, fine, great. I mean, I can help people with that for sure, and that
Yeah,
would be a whole different set of individualized approach. And we could
sure.
even bring the microbiome into that based off of, if it's acute trauma, not so much per se. There's always value to it, but if it's chronic pain, well, then there's a inflammatory cascade, there's a complex pain syndrome, there's a communication, neuroplasticity that perhaps we could utilize the microbiome for, like even like just a 20-year-old shoulder injury or shoulder pain, right? But so the individualized care, because of the services I offer, really can go many ways. But I would say like this, no one microbiome, no one person is the same. So if we collect data on their individualized presentation, whether it's range of motion or PCR DNA analysis of the microbiome or intracellular chemistry levels of micronutrients, right? Vitamins, minerals, amino acids, antioxidants, or if we look at nutrigenomics, or we look at pharmacogenomics, or if we look at genetics, just, regular, and not the impact of nutrition or the impact of genetics. I'm sorry, or the impact of pharmacology. Um, you really get an individualized picture, right? um, so, these are all tools in my toolbox. I often tell new patients, look, I have a chiropractic diploma, which gives me the rights and the scopes and the license to be your doctor. But chiropractic is not the treatment or the practice philosophy. It's a tool. Chiropractic manipulative therapy is a tool in my toolbox. How can I help you? Is how I get into that individualized care and collecting data. Collecting individualized data helps me to put
Right,
together an individualized care plan.
right. What's I think you said PCR DNA analysis. Did I get that right?
Yeah, sorry.
What is
Um,
that?
PCR is polymerase chain reaction. So it's a type of analysis that's very common in the laboratory lexicon, laboratory world. It's another way, kind of like my salad extraction with the Egyptian blue lotus. You sort of fraction out differences, right? So PCR will use genetic information based off of the molecular structure to fraction out information. So we're using that. Look, I'm not the lab, right? But can I do a plug? Should I mention?
Yeah, go for it.
So diagnostic solutions, I think, is the forerunner and at the forefront of microbiome analysis. Of course, you have other labs and consumer based studies, but from a clinical perspective, this is the lab that is going to be used in the highest end gastroenterology practices, my practice, to really study the microbiome. And we're using DNA. So as opposed to, say, using immunoglobulins or the body's reaction to bacteria, we're looking for the actual DNA. So we're able to really differentiate, is this bacteria here? Is it not? And it's the technology behind the information, essentially.
What are you sending into the lab for testing? Is it like blood tests?
Well, I send lots of samples. I don't send any samples. My patients will send samples.
Understand.
The foundational wellness program would include a hair sample for oxidative stress and environmental toxin burden, heavy metals, essentially, a blood draw, phlebotomy, anticubital from the arm, which is either done in the home or they go to a lab, for intracellular, which is inside the cell, and serologic, which is the fluid outside the cell, micronutrient levels, which are vitamins, minerals, amino acids, antioxidants, and essential fatty acid ratios. And the microbiome is done from home, which is a stool sample. So they make a bowel movement and they
Sure.
collect a little bit and they
Yeah.
send it in to the lab.
Cool. Very cool. Sounds like I need to make an appointment, Dr. Segal.
I'm here for you, man.
I hope your calendar's free. Okay.
After this, I don't know.
Well, that's the hope. That's the hope. We want to get this information out there so people know that there is better healthcare out there.
No, and
You're
by the
one of
way,
those people.
I appreciate it because, this is not really about me. This is about your listeners. This is about,
Yes,
I don't want to sound like too humble and like fake, but like I'm not being, this is really about everyone else besides me and you.
I
And
agree.
I often say like, I'm not on the Maury Povich show. I'm not Oprah, but
Yeah.
I saw in the health food store, the young kid, if we had something on our shelves for 15 years and it was just sort of obscure, it was sold. If Oprah talked about, SEACT fluorescence or whatever, like we couldn't get it in stock.
It flew off the
So
shelf. Yeah.
yeah, so but you giving me this platform, I'm eternally grateful because I hope if we can help one more person,
That's right.
it's awesome.
It's just the one. That's exactly my philosophy. I love that. Let's switch gears a little bit. Still on the gut health topic, but let's talk a little about and I got this off your site. The You talk a little bit about the prebiotics, probiotics, and what the connection is with a healthy microbiome, like what kind of role does it play in maintaining that?
Mhm.
And then what common misconceptions do you see, I
Yeah.
would say, often?
All right. Good. Easy question. Thank you. Um,
You're welcome.
so there's prebiotics, probiotics, and postbiotics, right? So just like in rehab, the best surgical outcomes are when we do prehab, which is strengthening the tissue before surgery, the intervention, the surgery, and then post-surgical rehab, right? Most people only focus on post-surgical rehab, but obviously, yeah, it's all important. So prebiotics are the fiber and the polysaccharides and the information technology that supports and nurtures the probiotics. Probiotics, people often think are only bacteria. There's also probiotic yeast. One of the most common is Saccharomyces boulardii, sold in CVS and Walmart and used in hospital settings as Floristat or Floristat. Um,
I've heard of
it's
that.
Yeah, of course. So they're doing commercials on it now, right?
Yeah.
We've been selling it for 40 years, but now there's commercials, and so now you know. So this is the impact of the platform. So again,
Yeah.
thank you. But Sac Boulardii is researched and clinically evidently useful for C. diff or hospital-based diarrhea, right?
Yeah.
Where
Yeah.
people take so many antibiotics, they get diarrhea, and they call it C. diff
Yep.
infection because that's the one that sustained itself and now is expressing itself. And Saccharomyces boulardii is a probiotic yeast, which supports the recovery from that said condition. But anyway,
Sure. Yeah.
so prebiotics, the nurturing fiber, probiotics, the organisms which are beneficial to us, and then postbiotics, which is the chemistry which the bacteria produce, right? The information technology that's
Yeah.
produced from that machine.
Okay. Makes sense.
You had more to the question.
Well, so I
Um,
was just wondering what the common misconceptions are
oh,
that you
yeah.
see daily or often.
So the most egregious one is people think that I just tell them to take probiotics and eat yogurt. And it's like, oh no, not even, I mean, I'll say like this, like some of my patients do take probiotics. Most of them will take individual strains. It's very individualized. So then the strains will be individualized. There is a benefit also to taking a broad spectrum probiotic. But it's not as simple as like just take a probiotic. And yogurt is a fermented food with lactobacillus. Here's the thing. Like the rainforest, the microbiome is an intensely unresearched, unknown, vast ecological environment, right? And most probiotics are only going to be, and food too. So fermented foods, kombucha, miso, sauerkraut, pickles, yogurt, kefir, they're mostly fermented with lactobacillus and bifidobacterium. So most of my patients, when we start looking at 5 pages of microbiological data on their actual, like what's living inside of them, like most of them have plenty of lacto and bifido, right? Why? Because those are the ones that are sold. Those are the ones in the probiotics, and those are the ones in the food. So again, I think the most egregious thought around what I do is that I'm just going to tell them they don't need me. They could just
Yeah.
eat yogurt and take a probiotic. And that's
Yeah.
just, if that were true, they wouldn't call me, and they do.
Right. Right. Yeah. Like go get some Activia and call it a day. Yeah.
Right. And look, like I'll say like it's not probably hurting anybody. You know what I mean? Like, I don't think it's hurting anybody. But like a lot of patients, they'll say, so I already eat Activia, and I already take probiotics, and so what is different? And I say, well, but you're telling me you don't feel good, or you have this diagnosis, or so clearly what you're doing isn't enough. So if you want
Sure.
something more, something different, here
Sure.
I am. But that would be the biggest issue. I think that the lack of understanding the diversity, the intensity of the study and the research and the potential clinical input.
Gotcha. Okay. I have another challenge question for you. You ready for it?
I hope so.
So if every listener, and I'm ready, I'm gonna take notes. If every listener could make one change today to improve their gut health, what would you recommend?
Oh man, this is definitely not a one-liner, right? Let's make it a one-liner.
Let's do it.
They could call me.
Nice.
No, but that aside, and it's for their gut health specifically.
Yeah.
So, fiber, right? So my mom has a PhD in holistic nutrition. So she is often part of the case management for my patients. When they come into that program, they're also, look, food is medicine, right? I mean, there's a lot of Instagram posts and this and that, and that's reality. The hard part is, besides the food being tainted, but the hard part is, we don't know. Oh gosh, it's just making me think. I don't know if you've seen that picture where it's like doctor says eat your vegetables, and then the farmer is like, and then they show the picture of the guys in like biohazard masks spraying the vegetables,
Yeah.
right?
Yeah.
So it's I don't want to be negative, man, but it's a wild world we're living in.
I get it.
But anyway, so she raised me as food is medicine and to eat your colors, right? The colors, the purples, the blues, the greens, the red, the yellows, the oranges, they often come in food that includes fiber, and they have a lot of polyphenol activity. So the polyphenols and the fiber, which is just eating vegetables and fruits, is probably the number one thing people can do for their gut, because we eat a lot of processed, in America, right? I don't know where your listeners are, but Americans eat a lot of ultra processed or processed foods, and they love their protein, right? They can't get enough of their protein, and protein's great. I do utilize a lot of amino acid protocols, and amino acids build protein. When we eat protein, we break them down into amino acids, and that's really important for tissue repair, mental health, neurotransmitter precursors, stabilizing the autonomic nervous system. But protein and amino acids do not fuel or feed the microbiome. So if they're not going to call me, the number one thing listeners can do for their gut health is consume more fiber.
Okay, good answer. So you get a 5 out of 5 for the answer, but you get 2 stars for how long it was.
So
okay, that's all right.
I understand.
I forgive you.
Well, the one-liners, they could just call me,
I'm just teasing. That's good. That's good. Actually, so I relate to this actually very recently. I don't know if you've heard of this, but there's something that it's called the Daniel fast. I don't know if you've actually heard of that.
I have
Daniel,
not. Enlighten me.
Daniel in the Bible, when he's presented with the choice meats by the king, he doesn't want to defile his body, and he says to him that he doesn't want it, but he was going to be forced to eat it. Then he says, "No, trust me, I'm going to be strong. You can test me." And he's like, "Just let me have, and it mentions a few things, I think, like, vegetables essentially. So it's a high fiber diet. So a few weeks ago, I did the Daniel fast, and I did it for 10 days. 10 days. I kid you not. So the first 3 days, I was a hot mess because I feel like my body was detoxing. And I gave this up for all 10 days. I do just drink black coffee, but I gave up caffeine completely. And look, who else do you know has a backup cup of coffee? I mean, I do. So I drink a lot of coffee. Anyway, I gave that up. I didn't have any meats, or like no fish, no chicken, no nothing. And I love me a nice piece of steak. But I had vegetables. I had whole grains. I even introduced some brown rice into the mix. And I felt right. Yeah. I felt like I was cheating. But not, and one, as far as the brown rice is concerned, I found this brown rice pasta. The ingredients was just brown rice, which was awesome.
Yeah, what's the
Um,
name? It's a blue bag or a pink bag. Tinkiata,
can't
Tinkiata.
I can't remember. My wife gets this stuff,
I probably know
but
it.
um, but but anyway. So at the end of the 10 days, Dr. Siegel, I'm telling you, I had more energy. I wasn't like bloated. I wasn't any like I felt amazing, and I'm actually doing a refined version of it now. I'm still having protein a little bit, but I get it. Fiber, I get it. It really does make a difference. So it resonates with me. Your answer.
I mean, there's a lot to unpack there,
Yeah.
a lot, and I don't know that we want to go into it too much, but if I can
Go
have
for it.
the
Yeah,
permission just
please.
to,
Yeah, floor is yours,
so I,
my friend.
yeah, I mean, listen, man, like, to be real, like always back to the evidence, right? Like when patients come in pain, I tell them, are you exercising? Because like I know you love me and you like the idea of chiropractic care, but like the number one thing for pain is exercise, mental and physical. So if you're not exercising, you know, sorry. Otherwise, when it comes to diet, right, or consumption of calories, the only diet that's ever been proven to extend life and depress disease or reduce disease is starvation. Now, if you take that too far, that creates its own presentation of
Of
problems.
course. Yeah.
So any diet, if you do this too long, you need protein, man. It
Hmm.
won't feel that good after a long period of time.
Of course. Yeah.
Now, again, you'll have listeners that go, well, what about those guys who sit on mountaintops and just breathe air and they sustain themselves, or the guys from the Bible who just, um,
Yeah.
okay, I'm not them, So if you can get there, great. I do believe in the power of the mind to control our experience, but yeah, I mean, I hear you. I will also say, I think that makes a lot of sense how you felt at first, like not good,
Yeah. Yeah.
because I'll say people will listen. They'll go, okay, diet, fiber, right? Great, great, great. And then they're going
Yeah.
to be like, I mean, I listened to your podcast. That doctor
Yeah.
just, now I'm bloated.
Yeah. I feel like
Now I'm,
crap. Yeah.
yeah, yeah, yeah.
Yeah.
So it's also like, it will help create um, it'll help create a better environment, but also it also can make sense to make the environment ready to take on those types of changes. Because again, I'll call it California healthy, right? They call me like, all I do is yoga, all I drink is wheatgrass, all I eat is kale, and but I don't feel good. I'm bloated and I'm constipated or I have diarrhea or whatever. And it's really goes back to the microbiome where their microbiome is actually not set up to receive that in a good way. And so there's too much methanobacteria, methane producing bacteria, and the fiber is just feeding the problem. So it's really, it's complex, man.
Gotcha. No, that's good. That's good. Um, yeah. Like I said, sometimes, and I'm sure that's true. This is true for a lot of people. Sometimes we have to kind of walk through that thing ourselves to kind of experience. So we can talk until we're blue in the face about, how good fiber is for your body. And then somebody tries it for 5 minutes and says, oh, this sucks. And then they walk away from it.
Yeah.
So my suggestion or my recommendation would be whatever it is that you're trying to become healthier, give it a couple weeks, give it some time. See
Would
it
you
through.
say commit to it? Would you say it's a
Very,
journey, commit to it?
very good word. I think I heard that earlier. I don't
Yeah.
remember when, but yeah, it's coming to me now. But definitely commit, because on the other side of that is one of two things. Either, okay, this is not the path for me, or two, a healthier life. So either way, it's just a short time in your life to just say, let me try this out. Let me see if this is going to work for me, but commit. It is a health journey. Commit to it 100%. Okay. Awesome. Great. So let's talk a little bit about functional testing, and the personalized care that you provide specifically, Dr. Siegel. So functional testing, it seems to be really the cornerstone or even pillars of your practice. So what sets it apart from your everyday medical testing?
Well, let's go start the roots of chiropractic because I'm a chiropractor, right? And so functional assessment, right? Someone has shoulder pain, and if you go to I mean, look, they should. Most allopathic doctors, whether it's an orthopedic surgeon, they for sure will do range of motion. Maybe if it's a primary care, they'll just listen. They'll say, okay, shoulder pain, they'll give you a narcotic or whatever, right? Muscle relaxant.
Yeah. Yeah.
Um, they're not assessing function. Uh, from a chiropractic perspective, someone has shoulder pain, we're assessing function. How does the shoulder function? How does the
Yeah.
neck function? Right.
Yeah.
So I would say what really differentiates the standard, LabCorp, Quest, comprehensive blood count or comprehensive metabolic panel, CBC, or CMP that is run commonly from a blood testing perspective, versus functional testing. The functional testing is going to be far greater in its depth and thoroughness. So you get more data on the why as opposed to the it. For example, just a light example, I hope. And this is what's coming to my mind. I don't know if it's going to go anywhere good, but if you look at a comprehensive metabolic panel, right, you'll get like ALT and AST elevated. Okay, so the liver enzymes are elevated. They're all non-specific, by the way. Every one of those biomarkers, they're called non-specific. It'll tell you something, but it doesn't tell you why. It just says the liver enzymes are elevated. And the doctor's job is to figure out why, in theory, right, to help the patient remove the problem. Very often we get caught in, and also in functional medicine, get caught in just treating the symptoms. But a more functional analysis of blood chemistry or even the microbiome might present more of a picture of why those liver enzymes are elevated. So I think it's the depth and the breadth and the thoroughness that I think is a differentiating factor. And it doesn't have to be unique. This doesn't have to be through me. I mean, if the primary care doctors did it, that would be awesome.
Yeah. Yeah. If they did a lot of things, it would be awesome. Okay. So let me ask you then, I have a follow-up. You said that these markers, don't have to be specific or whatever. So like, for example,
well, they aren't specific. Meaning a biomarker sometimes can be specific to, this means you have this problem, but most of them are just, hey, that tells us there's inflammation. We don't know where, or that tells us that enzymes are elevated. We don't know why, right?
Is that kind of like how they treat blood clots, for example, like when they look for D-dimer levels, like things like that? It could mean that there's a blood clot or something like that, like elevated
D-dimer is a little bit more of a sensitivity and specificity to cardiovascular risk. But sure, you're getting there.
Okay.
It's not the best example because it's more specific, but yeah.
Yeah, I get it. I was just trying to make the link in my head. Somebody in my life had a blood clot, and what helped them get to the hospital and get checked out was an elevated D-dimer level.
Correct, because that is a elevated sensitivity and specificity to say, hey, this is highly associated with this.
Yeah. Which, by the way, doesn't always mean that, just for the record.
Correct.
Because they had elevated levels later on and there were no blood clots anywhere. But
exactly. So it's associated with, but not 100%. So those who have blood clots will have elevated D-dimer levels, but those who have elevated D-dimer levels will not necessarily have blood clots. And that's across the board with everything that I could ever say to any patient.
So can you share with me a success story where like the functional testing maybe uncovered a life-changing diagnosis for a patient?
Yeah. I'll also say too, I don't know if we can go back just to the separation between medical testing and before we go to that.
Yeah, please.
So something that's really exciting me now and has a lot to do with the medical world, and I'm not an allopathic medical physician, right? I'm a chiropractic physician. So when I presented this to my mom, who does these case workups with me a lot from a Buddhist medicine perspective, she said, but we don't prescribe drugs. And I said, but Mom, every one of our patients, most of them are on drugs. And there's a test, I don't know if you've heard of it, called the PGX test. Have you heard of the PGX test? So it's a pharmacogenomic test. Have you heard of pharmacogenomics?
No, sir.
So pharmacogenomics are the individual's genetic relationship to pharmaceutical drugs. So this test will take a cheek swab, both cheeks, and then it will present that patient with hey, based off your individual genetic code, which then translates to your metabolic efficiency, inefficiency, whatever, right? There's thousands of medications. We've cross-referenced that you with all of them. And with the condition that you have, there's 10 drugs, pharmaceutical drugs that could be given. Of those 10, there's 3 which are the better option. And of those 3, there's 1 that is the ideal for you, that will be the most effective,
right,
and with the least side effects. And that just blows things out of the water. Because otherwise, right, the standard medical practice is to give the drug which the doctor has the most comfort level with, either because they get results with most and hurt some, right, or hurt the fewest,
Yeah.
Or not to sound inappropriate, but it's the one that the drug company said, hey man, if you sell enough of this, you push enough of this, you're going to go to Jamaica for a week with your whole family paid. And it's real, man. It happens. And
Oh, I know.
that's
Yeah.
the business. So,
I know. I know.
I'm not going to say that I'm, a perfect individual, doesn't have biases or influences, but so that I think really, again, when you get into the differentiation between how the body's functional testing, and I don't like buzzwords, man. To me, it's just good medicine. This shouldn't be called functional medicine. This shouldn't be
Yeah.
called functional testing. But for right now, this is above the standard of care. It's not the standard of care. It's above it. And most people sit in the standard of care, and that's where the insurance model stays.
Your standard medical environment, there's definitely doctors that care, right? So Dr. Segal and I are not saying like, everybody sucks, everybody's out to make a penny. No.
Absolutely not.
And you can tell who is and who isn't. Like you can sit with a doctor for, he'll come in for 5 seconds, tell you 2 things and walk out. That person doesn't care and they're just in it to...
he's doing his best.
Maybe, and maybe they're busy. But the point is, I think it's up to the patient also to ask the right questions. Hence these type of podcasts and informational outlets, right? Ask questions. Don't just take their word, as gold. It's okay to push back. It's okay to say, well, why are you prescribing this? I watched my own parents walk through a life of just medicine after medicine after medicine. And that is just not a life for anybody. It does not create a quality of life at all. So when you're sitting in a doctor's office, I'm sure they care for you. Actually, I know they care for you. A lot of them get into the profession because they love people and they want to take care of people. But ask
20
questions.
years later.
Yeah. But ask questions. It's okay to ask questions and understand what's happening, because you might uncover another path for you that's better.
I like the word empowerment, right?
Yeah, that's good.
So empowering yourself, because, pushback, like that could be, that can create an environment of, whatever, tension. The doctor-patient relationship is sacred. And we've removed some of that with those commercials and say, ask your doctor about Celebrex. So the doctor's like, well, don't I get to tell you what I think is best? And the problem is, that's maybe we'll do a second podcast. But
I think we should.
It's important to empower yourself, and I highly respect my colleagues. I work closely with them. I have relationships and referral patterns from hospital-based doctors to gastroenterologists to mental health professionals and psychiatrists and psychologists. And that's because I think I don't present myself as antithetical, or, I'll tell. My favorite line is when I say, Mrs. Jones, you should go get I hope I don't get in trouble with my chiropractic colleagues. Mrs. Jones, you should go get an injection, I mean, she goes, but you're a chiropractor, And I said, yeah, but you're 80 and you're suffering, and I've been treating you for a few weeks. And I think the risk benefit analysis here, if I take my bias aside, or really just think about you, evidence-based perspective, and you said it right. You said quality of life. I will often say, I'm not not all heroes wear capes, right? But I'm not thinking about the COVID times. I'm not the hero from walking out of the hospital getting, whatever. And I'm not replacing heart valves. The guy doesn't wake up and go, you saved my life.
Yeah.
But I have saved lives. But what I really focus on is, and I say, I saved quality of life, because
that's good.
You brought that up. So your question about,
so that's a good
what
segue.
Is functional testing?
Yeah, it's a good segue, because you said you have saved lives. So functional testing, like, has it, or just share a success story with us about maybe a life-changing diagnosis for a patient.
Right. So it's interesting. So you say so most of my patients come diagnosed, right? So the life-saving or life-changing really comes from the approach and the protocol, and they come diagnosed, most of them. And sometimes I have to deprogram them, irritable bowel syndrome, right? Okay, so your bowels are irritated, and the guy had to, the doctor had to tell you that, so there's a little bit of deprogramming there. Or when they come and say, I have a bad back. No, you don't. You don't have a bad back, But this did happen recently. So just to keep it short and sweet, and impactful. So a couple came to me. They were, middle-aged, boomers, I guess, baby boomers. And they probably have kids a little younger than me. And the wife was more diagnosed, and the husband was more like, I'm healthy, I feel great, but I want to go on this journey with my wife, right? So she came with more known problems. He came like, not the farmer, like, I'm fine.
Yeah.
Why are you here? I don't know. My wife told me to come, right? Not that. He was open, right? Um, anyway, so I ran my foundational wellness program. And I think with him, yeah, this is what it was. He had a family history of cardiovascular illness, maybe an uncle, a grandfather, a father, a brother, whatever it was. There was a family history there. So I said, look, while we're doing this, and since you seem like like and trust me and you're open to this process, would you be opposed to me running like a functional level analysis of your cardiovascular risk? And he was like, well, I see a cardiologist. He always tells me I'm fine. So, sure. So we did that. And, I'm not a fear monger. I'm not into making mountains out of molehills. He was absolutely not fine. The more, functional biomarkers really showed a picture of tremendous dysfunction and potential for life-threatening events. And he said, thank you very much. He began my protocol. He went back to his cardiologist, and his cardiologist was like, that doctor saved your life. The
Wow.
cardiologist. And I'm not a cardiologist,
Yeah.
I live in a big city, but I'm a small town doc at my
Yeah.
heart, mom
Yeah.
and pop, just customer service.
Yeah.
Um, and so, is that good enough, man?
That's amazing, man. No, the fact that the cardiologist said that doctor saved your life, that means that that's an open-minded doctor right there. That means that he realizes that there's other solutions out there than just what he has learned. So, or she. So that's phenomenal. One,
I think it was a he, and this is the thing. And it could be a she, but it just it was a he for sake of conversation. This isn't. I'm not doing chiropractic work. I'm not doing cardiology work, and like man, like that cardiologist should be. I mean, he could be doing this. This is not exclusive. These labs are CLIA certified. These labs are being used by those 20,000 doctor medical concierge practices. Like this stuff is out there, and
yeah,
it's just not the standard. But the more we expose it, the more it should become the standard. And that would be
sure.
great.
Yeah. Um, I think if we open our mind to mixed solutions, I think we would get better healthcare. Because if we just have a narrow mind, like I talk about this all the time. I know people in my life that just like tunnel vision, medical industry, or tunnel vision, chiropractic care.
Thank you for saying the both of them.
Why not both? Why not both? Why not get the adjustments that you need, get the chiropractic care that you need, and possibly something. One of the guests I had on the show a few weeks back, he said we have the best medical care in the world, and he was referring to hospitals and doctors, not the chiropractic side. He's like, we have literally the best. If you have a gash going down your leg and it's bleeding profusely, don't come into my office. Go to an emergency room where they're going to take very good care of you, right? So he was kind of talking about acute versus not.
Yes, better.
Yeah.
I would say if you're shot, God forbid, or in a car accident or gash in your
Yeah.
think
Don't
me
come
to an
to me.
American, American hospital, not Thailand, not Russia,
Right.
American hospital.
Yeah. I think we need to keep an open mind when it comes to that. So I'll segue into this question. So I think your individualized care, would you say, I'll start with a yes or no. Would you say that there's an art and a science to it?
Of course.
Okay.
Yes.
So that being the case, how do you balance the two in your practice?
I hope I do. I don't know that I do.
Okay.
I think, let me give a sweet answer. I think co-managing these cases with my mom, she's an artist. She painted all the art in my office.
Love it.
She's a tremendous, talented artist, and I, have some of that. But my clinical sort of mindset is very biochemical, very like dosages and time frames, and so when they interact with her, it's this artistic, warm, fuzzy hug of a motherly nurturing. And when they deal with me, they get that more young, youthful male. I don't want to use negative words like aggressive or intense, but specific and focused answers. So that in and of itself, there's a balance
There's
there
a balance.
of
Yeah.
art and science.
Yeah.
Maybe I'll leave it there. I probably have other, I mean, I have other answers,
No,
but
that's good. I like that.
yeah, I also like the evidence-based approach, right?
Yeah.
So the art is, the art is changing. I can't change anyone, right? I can only change myself. So the art is in changing myself and adapting myself and my program and my methodologies and everything to that individual to
Yeah.
make it individualized. And the science supports that from an evidence-based perspective, taking into
Yeah.
account me, the research, and the patient.
I like it. I like it. I got another $1 million question for you.
These
All
are
right,
great questions. You're great.
So here's the challenge for you. So if you can develop one new diagnostic tool or a test, what would it be and why?
So I have this. Okay. I've been saying this, for a long time. I feel for my patients who have to be poked, prodded, make stool samples, send them in, spend months with me, money, time, all that. If I could invent a portal type, like CAT, like you walk through it and it gives me genetic information, lifestyle information,
Mm,
thoughts, background, childhood, trauma,
mm,
microbiome, blood chemistry, cellular, serological, oxidative stress, metabolic rate, HRV, right? Heart rate variability. If I could just get all that with like a pass through and it was not expensive, didn't take time, and was non-invasive,
mm.
that's what I would invent.
I love it. My cousin,
Making
who's
one?
well, well, I don't know. He's in robotics. He's actually in Israel, and he has a company that where he develops these kind of medical industry robotic type tools. I
Like
think
the
we need,
pill that they swallow and
yeah,
stuff.
that kind of stuff. Yeah. So maybe we need to sit with him and tell him your vision and see what we can come up with.
I
Um,
would love that.
yeah. All right. So, wow. First of all, this
Yeah.
has been amazing, man. Your answers have been on point. So I really appreciate you taking the time. But we're going to continue a little bit here. We're going to segue into the chiropractic care piece. So you like we've been saying, you offer a wide kind of gamut of chiropractic services, right? Spinal
Yeah.
decompression. I think you do cupping, right, as well?
Sure. If I need to or want to or they want.
Yeah. So how do you decide like which therapies are best for each patient? I know we talked about personalized care and you do your testing and then there's not one straight answer, but like what's your markers? Like how do you decide what the best therapies is for each patient?
I mean, it's easy, but it's complicated, right? I mean, the time I have, did they come on time? Did they come late? Do I have to sacrifice something, you know? The case history, is it acute? Is it chronic? Their age, if someone is, an infant. I had a 7-week-old in the office yesterday. I'm not cupping a 7-week-old,
Right.
or if someone is 90. I don't see a lot of the elderly population, but more with the other work I do, but physically in person. I'm not a Medicare-based provider, so
Sure.
I refer them out. But their skin can be very thin. And look, contraindications, indications. I mean, that's a very easy question because if you're a doctor, you do exam, you do consultation, you take into account the case history, the presentation, and it's also visit by visit or data I have, right? So I'll also ramp up, right? Like someone comes in, it's like drinking from a water fountain. I'm sure from like water from a fire hydrant, right? So I have to and I would say the same thing with I do a lot. Most new patients that come in chiropractic are going to come in, they're going to get consulted with, they're going to get examined, they're going to get thorough informed consent, then they're going to get thorough treatment. I would say if I'm not doing, myofascial release or cupping, I'm doing some sort of ischemic compression, some sort of muscular technique.
Sure.
Usually chiropractic manipulative therapy, usually some non-force technique like spinal decompression or flexion distraction. And then they're going home and then they're getting an email with a home exercise program, right? And also some internal, like I'm not necessarily going to overwhelm them, but like they're going to get 2 or 3 exercises that they need for sure to do on their own because I don't have the, I don't I don't do that in office per se. And then, but they need to do it. Exercise is number one. And then I'm going to recommend maybe specialized pro-mediating factors for their inflammatory cascade because they're in pain, or maybe proteolytic enzymes because they're a hockey player and they've got, bursitis or whatever. So I'll email them. So that's already pretty comprehensive. And then if I'm going to bruise them up the first visit too and hurt, cupping can be uncomfortable. I just generally I'll do that as a flow as opposed to right on.
Gotcha.
Unless it presents itself in the way that it should. I kind of use more of a spinal condition patient. But if it's rotator cuff injury, I might go right to cupping.
Makes sense. Yeah. So, well, that said, a lot of people, including myself back in the day, I would say only saw chiropractic care in one way, which is you walk into the office, you get a spinal adjustment, and you walk out. There's obviously way more to chiropractic care than just spinal adjustments. So how do you during their sessions educate patients on really the broader benefits of chiropractic services, or do you kind of leave that more for community events or things like that, or how do you communicate that to your patients?
All right, loaded question.
Okay.
So anything from the presentation of the office, when they walk in, there's my mom's art. There's not a picture of whiplash injury, or an anatomical, spine. I do have spinal models, of course. I use them, to educate patients. But
obviously, yeah.
But it's it's a presentation of the office, and then really I try not to, honestly. I do it organically. I try not to. Most of my patients are word of mouth. Most of my patients are already educated on, they don't need a chiropractor, they need Dr. Segal. Why? Because I came to him with this and I got that result, or the doctor, the gastroenterologist that refers to me is they're not coming in for adjustments. You know what I mean? They know that already. Now I might present to them chiropractic care. I might say, since you're local and you're not far away from me, I can also utilize chiropractic. The adjustment is tremendously powerful. If it wasn't, and it didn't help anybody, it wouldn't be used in osteopathic medicine, physical therapy, chiropractic medicine, Chinese massage. It's real. It's there. I don't think we need to deal with any of that evidence.
Right.
It's been proven. So, and then you can get into the deeper side of regulating the nervous system, right? We know that the cervical spine relates to the parasympathetic nervous system, rest and digest. So an anxious patient should be, perhaps manipulated in the cervical spine. Anyway, so I try not to, though. I try to have people do it for me. I do have very excited patients who preach, right? I have my mom who's out there in the world. She, when we had the health food store still, that was a tremendous, fuel for the practice.
Yeah.
Subsequently, my parents have sold the family business and the house, and they came down near me full time and retirement. And I'll tell you a story from yesterday. So, when someone comes in for chiropractic care, how do I teach them about, the other broader aspects of what chiropractic could be? And it's not to belittle the adjustment. Again, it's tremendously important, but it's a tool, right? And not everything is appropriate for every tool. But this woman comes into me yesterday, and what does she come for? She comes for hip pain. Okay, hip pain. But when she's describing hip pain, she describes it in a way that she doesn't have hip pain really. She's got pain that comes and goes, pain that moves around. There's some interesting aspects to her case history, right? So, of course, I'm going to examine her range of motion and do orthopedic testing and neurologic testing, and I did.
Right.
But sitting there in those first few minutes, I said to her, is there autoimmune disease in your family? And she goes, not that she was happy to say that yes, but she's like,
Yeah.
I'm not. So she said, yes, my mother, my aunt, my uncle, my cousin,
Wow.
lupus, rheumatoid arthritis.
Wow.
So I think the smile for her was the recognition that she's not in a chiropractor's office to be adjusted. She's in a doctor's office to get healed.
Yeah. That's good. That's good. I love that.
And that was an easy way for me then to hook, line, and sinker, man. I'm like, well, let's work on everything that's associated. I'm not going to overwhelm her. I didn't present to her my program or anything like that. I mentioned lightly how the microbiome could impact, the expression or the remission of pain syndromes or autoimmunities or whatever. But I also said, hey, listen, there might be something anatomical also. So let's
Yeah.
evaluate you from a chiropractic perspective. And I'll tell you
Yeah.
something interesting just as an aside too, or to the point. I said, can you stand up? I want to look at your feet. But you're not a podiatrist. I said, well, I mean, she has severe hyperpronation more on the left than the right, and her
Right.
left hip hurts her. So, I mean, I adjusted her. Okay. She also had left SI joint hypomobility. I adjusted her.
Yeah.
She walked out feeling better. But I think to really sustain to get to her goals, which they're short term and long term, I'm not going to go into the whole case with you, but to really achieve her goals, she needs orthotics. She needs, functional work. She needs my other work. And she also needs to be adjusted here and
Yeah.
there, you
Yeah.
know?
Yeah. Yeah. So there's chiropractic care, like spinal adjustments and things like that, is actually becoming more and more popular for the wrong reasons.
Yeah.
You can blame TikTok for that,
Yeah.
and the clickbait, but I think
Click
where I
bait,
yeah
click, like
yeah
literally click.
crack bait, yeah, no.
Yeah. Yeah.
um, but I think it's although it's becoming more popular for the wrong reasons, um, I think it's a great opportunity for doctors like yourself to, I hate to use this word, but capitalize on that, because you can get people in your door and really help them. Not so that you can clip a microphone to them and hear the snap, crackle, and pop so you could put it on TikTok. But really bring them in and there's nothing wrong with that. It's fine. But if you're
Sure.
in it
It's
for
a
the right
model.
reasons, great. It's fine.
It's a model. Yeah.
But I think it's a great opportunity for doctors like yourself to introduce your methods, right?
Yeah, of course.
And capitalize on that, because now it's becoming more and more popular. And I'm saying that to you, and I'm saying that to other doctors that are listening, because my audience does span both doctors and patients like myself. But I would say capitalize on it. I think now's the time to really just kind of just dig your nails into the moment and get as many people through your door as possible,
Yeah.
and teach them the right thing and help
Yeah.
them get and live better lives. So,
Yeah.
all right.
I mean, we're using technology right now to do that.
Yeah, exactly.
Podcast is a version of that.
Exactly. So for those of you listening, if you're actually interested in being a guest, we can talk and we can see if we can make that happen.
I highly recommend it.
Yeah, thank you, sir. Thank you. So let's talk a little bit about and if I'm saying this wrong, forgive me, flexion distraction technique. Is that right?
Yeah, no. It's a doctor, Dr. Cox, COX, Dr. Cox. It was a chiropractor, and he invented a low force or no force technique called Cox flexion distraction. So in the chiropractic college that I went to, we practice diversified. Diversified means it's not Gonstead, one guy's one way. It's not. It's all we got exposure to all of them, right? So flexion distraction technique. Should I demonstrate a little bit? I mean, my table's right behind me. I don't know.
Yeah,
It just
do
let's
it.
see if you can see it. You see the table? Can you see it behind my
Yes.
chair?
Yes.
A little bit.
Yes.
Get that out of the way.
Yep.
You see some of the things behind me too. I do bilateral nasal specific, so there's some sphinx bulbs and little balloons. I put balloons at people's noses and adjust the skull bones though. But
I've
anyway,
seen that. Yeah.
the table goes left and right, and it goes up and down like this, up
Yep.
and down and left and right. And so that is a very gentle way to help people with low back pain. And it's just that it's not special to, I mean, I don't think it's unique. I mean, every chiropractic student is going to be exposed, I would think, to flexion distraction technique.
Okay.
But when I first started off, I didn't have funding. I borrowed $5,000 from my grandmother, and her soul should elevate from the mention of her name. But so I had limited funding, and I wanted a table that could do it all, right? So I could treat 120-year-old people very gently without, because people are like, don't adjust me, don't crack me, or they have brittle bones or, osteoporosis. And my table has a drop away for pregnant women to lay face down.
Cool.
Yeah, it's a pretty dynamic table. I have other, tools and tables, but so that's flexion distraction technique.
Gotcha. Have you used that approach, like solely used that approach with some patients, and do you see results from it?
I don't solely use it. No, it's something I use often with almost every patient. I'll spend a few minutes, doing that. In my training years, I I did see that used solely and exclusively for traumatic disc injuries and produce results. Absolutely.
Gotcha.
Um,
Gotcha.
I'm a little bit more into the technology, so that's where the 2.0 is non-surgical spinal decompression. So I have a
Right.
separate table in a different room that is, flexion distraction with a brain, with a computer, with automation, with protocols, with research, evidence-based, double-blind,
Yeah.
that kind of pre-MRI, post-MRI. So I like the non-surgical spinal decompression
Yeah.
if I'm doing more.
Gotcha. Yeah, that was going to be a follow-up because I didn't know what that non-surgical spinal decompression was. So,
Yeah,
okay.
it
Yeah.
started off as from a health minister in Canada. I don't remember exactly all the names and all the the family tree, but I believe he was
Yeah.
a neurosurgeon or neurologist. Um,
Okay.
so he was like, well, traction helps people, right? But the problem is that they create injury because they do it for so long, they create ligament laxity. So what if we do traction relaxation, like more like a sponge, like like an accordion, and then he put technology into a thing with like a winch, and then it became over years. It kind of fell away from a a medical procedure, and is now mostly physical therapy, chiropractic offices or disc centers. There are specific practices that are just disc centers that only do disc injury recovery and only use non-surgical spinal decompression
Gotcha.
technology. But it's essentially a table with a winch and a computer that does this, and we latch them in, and it's gentle, mostly non-perceived, but it creates a lot of reactions. It creates a stimulation of the mechanoreceptors with the movement, so that's rehabilitative neurologically to tell the body that there's movement and to create neuroplasticity away from the pain syndrome.
Uh,
Um, it rehabilitates the multifidi, which are the deep postural muscles. So if you think about a spine, bone, disc, bone, disc, bone, disc, like a sandwich, right? Like a big sandwich.
yeah.
Um, uh, there are little tiny strap muscles that just go from level to level to level. And those are the
Okay.
first ones to be inhibited when there's back spasm, right?
Oh,
So we need to rehabilitate those in order for the remission or the recovery to be complete and sustained. That's like almost like the post have, right? Um, and
gotcha.
um, and then the disc injury itself. So we do have pre and post MRI imaging where there's surgical needed right? This could use surgery. Disc injury, you see it on MRI, like just the material pushing out,
Yeah.
and then it's gone. So there's a that technique is highly
Gotcha.
efficient and successful for disc injuries with positive MRI findings, and I've seen that in practice. I've done that. That's yeah.
Very cool. So that sparks a challenge question for me or
Oh boy.
for you in my head. But if there was that one chiropractic service that you wish every patient would try, what would it be and why?
Oh my gosh. Oh my gosh. I don't know. The one chiropractic service, huh? Uh, one chiropractic service. Um, okay. I'll blow your mind. One
Oh,
chiropractic service,
one.
microbiome testing.
Just the testing?
Well, the microbiome evaluation optimization. I see it as chiropractic.
Answers. Yeah, for sure. Okay. All right. That gets a gold star, man. That's 2 gold stars in one session. That's amazing.
Yeah, I mean, I don't want to, I mean, I see that as chiropractic. I
No,
know it's
that's
not
good.
adjustments. I know it's not activator. I know it's not flexion distraction. I know it's not myofascial release. But to me, I'm a chiropractor. That's
Yeah.
chiropractic.
Yeah. I love it. No, great answer. Great answer. So we're going to segue into the part where I have fun. This is where I geek out. This is where my heart lies and my experience lies. So we're just going to ask a little bit, we're going to ask some questions around the business and the marketing, if you're good with that.
Sure, absolutely.
So let's get some questions under our belt. And I do have a challenge question for you. So get ready. That one's like going to fire right at the end of this. Got a couple questions first. So your
Sure.
practice
Yeah.
emphasizes really on the personalized care and the education. We talked about that a little bit. And we kind of talked about how you educate your patients. And you use moments in your conversations with them possibly, but that's your patient. That's somebody sitting in front of you. How do you communicate your unique approach to potential patients, Do you simplify? Do you throw everything at them? How would you communicate to your potential patients?
So again, tongue in cheek, like I try not to, right? I really try to stay out of that space.
Yeah.
For better or for worse, I'm more likely to do like a community event, like an educational set, webinar or talk, right?
Sure.
But I'm a little bit like the tech guys in San Francisco, right? These guys create all this technology, they help, but they don't use it, right? Like their kids, like Mark Zuckerberg's kids, I don't think they have Facebook accounts, right? I
Yeah.
could be
Yeah.
wrong, but I've heard this type of, right?
Yeah.
So I don't personally use Instagram. I don't know how to get on. I don't personally use Facebook. I don't know how to get on, but I do have a presence on both of those. I did have a presence on TikTok. I subsequently, for political reasons, I guess, just felt like I don't want that
Yeah.
near me at all,
Sure.
even in the
Sure.
business space. But
Yeah.
my favorite TikTok I ever made was supplements don't work unless you use them. Because a lot of us, right, we buy supplements and they sit on the shelf. They're like,
Yeah.
it doesn't work. I'm like, well, do you take it? No, it's just sitting on my shelf. Anyway,
Yeah.
I'm getting off track here. So I do have someone that helps me, right? She's a happy patient. She's somebody that, has utilized my services, seen results with herself, her husband, her kids, and she like loves this stuff. She's like a social media maven, right?
Love it. Love it. Love it.
So I kind of let her go with it, and just she
Yeah.
knows how to log in, and she just takes content. But I produce content. I think, if you're not using AI and you're not using social media and you're not doing podcasts and you're not
Preach it.
using technology,
There you go.
you're dead in the water, man.
Yeah, I agree. I agree. So we talked about your program a little bit, the path to a healthy gut. And I know you said that might not necessarily be the name or whatever, but
Yeah.
so
The foundation of wellness.
foundation of wellness. Well, then you got to update your website, man,
I know.
because yeah,
I have a separate website for that exclusively, but yes, you're
oh,
right.
okay. So then that's on me for not finding it. All right. So
That's
so
okay.
then how is that?
It's on me
How
for
is
not
that?
making it easy to find, I guess.
So it's positioned your practice, right? Um, I would call it the niche of a niche market. But how has that program itself, how has it helped you position your practice in a really competitive healthcare market?
Yeah, man, it is super competitive. Um, I would say like in a world where anyone can say anything to anybody, anywhere, at
Yeah.
any time, just being convicted, just having convictions, and that gives clarity. I often joke that I don't know why I exist, but I'm grateful, right? Meaning the gastroenterologist who refers to me like should be doing this work.
Yeah.
He'd rather refer it to me, right? He's getting paid from insurance for endoscopies and colonoscopies, and he understands the value, but he doesn't do it because I don't know why. It could be he can't wrap his head around a non-insurance based care model. It could be
Yeah.
well, I know he's bought out by a huge conglomerate, so it could be a corporate restriction.
Yeah.
And he's not able to be a doctor. He's only able to do what they tell him. And I don't even know, like I've reached out to him so many times, like I haven't gotten a clear answer. Like, does everybody know what you're doing? Like, do they know you're referring to me? But so an education, right? You got to be an expert. Like years ago, when I first was building this idea out of a remote practice with microbiome information and testing, and it was long before COVID. Like the guy I was working with was like, you need to just be the expert. You need to because I'm not a gastroenterologist, and if I was, probably the things I say would be more easily heard.
Mm-hmm.
So for me, I have that extra barrier, right? So I mean, I haven't added any letters to my name, but I'm always learning. It's a very much a growing space, right?
Yeah. Yeah.
There's constant advances in information technology and then clinical application thereof. So, got to stay relevant, man. I
Yeah.
just, the
Agreed.
niche of the niche, again, I don't know that it shouldn't exist, right? This should be the standard of care. This should be like
Agreed.
obvious and normal and easy and accessible and cheap, and insurance based or whatever, whatever.
Yeah. I get it.
But I don't know, man. I'm blessed. I'm grateful. I'm grateful that I'm grateful to be here doing this.
Yeah.
I don't know why or how.
Yeah. Yeah. No, that's good, man. That's good. I think you and I need to conquer the world with your practice. So we gotta talk about how we can do that, man. So, I don't think enough people have access to you. That's just me though.
No, I
Um,
agree. Well, they
yeah.
could have access. I have, I'm not there yet, right? I'm limited so far, thus in my ability to have a platform. So that's immediately why I agreed to do this with you.
Yeah. We'll get you there, man. We'll get you there. So you have a blog also, and then I believe you have an online store as well. And those are great resources.
Also
But
need to be updated constantly.
yeah, yeah, yeah. So, but how do you see kind of the digital content, e-commerce, um, social media, all that? How do you see all that being a part of the future of your practice?
Yeah. So it's the current, it's the future. Again, if you don't utilize it, you're doing a disservice to your people. You may not like it. Like I don't use social media. But if I just say, well, that's not for me, I'm hurting people because, not doing something is sometimes worse than doing it, right? The
Yes,
bystanders with their cell phones and they're just watching somebody get hurt.
yes,
They're not intervening,
I
right?
agree. Yeah,
So sometimes the not doing something is more powerful or hurtful, uh, and not empowering, if you will, than the doing of something.
yeah,
So, anyone listening, yeah, look, any doctor in today's world, there are chiropractors who do utilize the microphone clip and the sound, and that's great. Like if that's their business model or that's their practice model, and that's what brings people in, like God bless you.
sure.
Um, for me, like that wouldn't work because I'd be bringing in patients who are looking for that.
Mm,
And although I provide that, my time is limited, my energy is limited, and I want those people to get help from the other doctors who do that really well, really fast, really quick, and let me do what I do really well. So yeah, so social media, AI, um, all of it is really, really relevant. It's the future of my practice. I
yeah,
continue to try to use AI to automate. Um,
yeah,
I've gone back and forth. Do I hire a health coach or integrate with a health coach to like do the background stuff? Because right now I'm a one-man show in many regards.
right.
My mom helps a lot with that follow-up stuff because I just get busy with everything else I'm doing, and she's semi-retired and she likes those conversations. She has whatever. She really, I don't, it's not that I don't enjoy those conversations, but
Your time is limited.
everyone's time is limited, man.
Yeah,
But
yeah.
everyone has their niche, right? Everyone has their skill set and their passion. And so yeah, so do I utilize a health coach or can I utilize AI to like automate this? Because at this point, like I've got enough patterns of communication, of protocol with information technology, right? Um, and then can I just like can I present this almost as a curriculum? Can I present this as can someone click in to my program and get the kits drop shipped to them, get, the results given back to them,
Yeah.
have me go over their results, but do it in an avatar state. Because I've already pre-programmed the machine learning to know what I know with the
Yeah.
patterns and what I would say and
Yeah.
do, and
Yeah.
then present a protocol, you know, like that. Like, so
Yeah.
that's it right there, man. Like
Yeah.
that's technology, right? That's
Yeah.
AI, that's social media, that's avatars. I don't know
Sure.
what I didn't touch on or if I did a good
No,
answer.
that's good. No, that's really good. I would say that AI is definitely um right now is a scary thing for people. But you touched on the right terminology, and that's machine learning. Um, think of it as your student that can't get it wrong. Once you feed your student the right information, they're going to pass the test 100% of the time. So if you build a model around the things that you know and create these if then situations, if a person is experiencing this, then this. Well, if they're experiencing this and this, then this, and
Yes.
so on. And you can build a model around uh, 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 um, I would say answering maybe simplified questions without giving away information that could hurt them if it's not for them. So AI can be scary, but if it's used the right way, and honestly, sometimes it needs to be left to the professionals, hence why I'm here. But if you can do it yourself, great. All power to you. Don't be scared. Jump in, dive in. You have a test market too. Like, create yourself an A/B test situation. Talk to patients that are willing to feed it information about themselves to see,
Yeah,
there's a lot of ways to go about it. So
100%. It's a little
yeah,
scary too for me because like it's a two-edged sword, right? Because like also I built my practice off of the humanity and the individualness of myself. Um, and the humanity of the patient, right? What's different from you and a medical doctor? Well, they don't listen. I listen. Well, now I don't listen. The machine listens. Like, so it's, I mean, it's
yeah,
there's a lot that goes
yeah,
into
no,
it.
I see what you're saying. Definitely don't lose the personal touch. That we don't want to remove the human side of it. I think it should be used more for entry level, right? To kind of open the door with prospective patients, and maybe give them, the initial steps of what they could do for a healthier life. After that is when Dr. Segal needs to get involved in more personalized care and things like that. 100% agree with you. Do not remove the human interaction at all, because then now we're just, having robots take over everything. We don't want that.
No, we don't.
We're going to lose our culture that way. So yeah, let's not go there. So I preach a lot about patient success and, referrals and just kind of testimonials and all that. I think those are key for every practice, no matter what you do. So what role does that play in your practice, or does it?
It's everything. It's absolutely everything. Like I mentioned, almost every one of my patients comes from a referral from a patient success story, and I'm highly motivated to get success. So these days, the insurance model is changing where they are paying more for doctors who see patients less. They're paying more for efficiency because they've come to be right away from the fee for schedule model where like I do things, I get paid for what I do. Now doctors are being paid out from insurance companies for how efficient they are and measuring that success. So it is going towards a chiropractic model. But I don't have, I have to have success. I'm highly motivated to have success because people are
Sure.
paying me directly.
Yes.
They're highly uneducated, sometimes suspicious, nervous, scared, and very ill in many ways, or have tremendously impactful diagnoses.
Yeah.
Um, and I have no corporate funding. I have no hedge funds. I have no investments. The patient and I are literally working together. And if I
Mm,
don't get success, I often tell patients, if I wasn't like, it's not a sales pitch, but it's a sales pitch. Like, I'm like, because like, well, how can are you going to help me? And like, listen, if I didn't help people, like I wouldn't exist because literally I'd be out of business because there is no other way for me to succeed except get results and have people be so impressed or so excited or so helped that they want to tell other people.
I love
So
it.
those
So
success stories are huge, and I do my best to collect them. People are shy. It's also a weird space because healthcare is like protected health information, and
yes.
people don't want to get on video and go, "I was, wearing a diaper and bleeding out of my rectum, and Dr.
Yeah.
Siegel helped me." Um, so so I do struggle with that sometimes. Sorry, man. Comic relief. Um, but
Wow.
I do have them. I do
Okay.
have them. I try to collect them,
Yeah.
and they
Yeah.
help a lot. They're everything
Yeah.
to me.
Yeah. Okay. Good stuff. Good stuff.
Sorry, Tom.
Okay. Bleeding rectums aside, I have a challenge question for you. That's
Okay.
hilarious. Not making fun of anybody that actually is experiencing that, but that just caught me off.
No, just yeah. In the moment, it was
Yeah,
unexpected.
that was funny. So, challenge question: if you could, if you could give one piece of advice, um, more business advice to other healthcare professionals, chiropractors, looking to grow their practice, right? What would it be?
One piece of advice to help grow a chiropractic practice. Um, Easy, man. Like open more doors than you close,
Mm,
and don't cross your arms like this and be unopen. Open more doors than you close, and mindset, take opportunities, and be proud. Like I've been up and down. I've had those. So I've been out 15 years now, basically in practice 15 years, and I've had the whole gamut of the roller coaster of relationship with what I do and who I am and my degree. Um, and to grow a practice, you have to have conviction. You have to be proud. You have to be open to learning new things because the people out there are the patients are learning it. They're going to come in. You don't want them to know more than you per se, and the doctors out there are gonna be doing it, learning it, and implementing it in practice. So
Yeah.
when you get an email
Yeah.
from a strange email
Yeah.
that says, "Would you like to be on my podcast?" Don't dismiss it. I have
Yeah.
no idea. I had no idea anything, man. I was like, yeah, absolutely. And I can tell you, I've been doing that for years, and this is the first one
Wow.
I've done. This is the first
Wow.
one I've done because it's the first one that's real. But I never
Wow.
stopped saying yes. I always say yes until I
Wow.
find out that it's not real or worth it.
Great advice, Dr. Segal. And if I can just interject a little bit here, um, Dr. Segal is, I would say, a unicorn in the chiropractic care industry, only because he understands the value of the social media. Doesn't use it, doesn't know how, but understands and wants to implement. He understands the AI and wants to implement. That's where you guys need to be. And if you are afraid, and if you don't want to dip your toes into it, that's why people like me exist. I'm sorry for the plug, but guys, we got to grow your practice. We got to get you out there. We got to make sure people are getting the right healthcare. We got to stop getting our communities and our world and the United States pumped with meds. That is not the solution. So let's do it. Let's grow your practice together. Seriously, let's. I'm here. We'll talk if you want to.
Amen.
Yeah. Yes, sir. Yeah. Yeah. Okay. Sorry. I didn't. I don't normally do that, but I don't just something really heavy on my heart. So whoever's listening, just reach out. We'll chat. We'll chat. And look, I'm okay with hearing no. I hope you're okay with hearing no as well. I can't help everybody. I literally just take on 2 practices a month, no more, because of how personalized my solution is. So I can't work with everybody. But if you're interested, we can chat. But Dr. Segal, really, thank you. Your business advice has been amazing. Your experience. I mean, Amazon, really, just amazing. But
let's go back, man. Let's go back.
Let's do it. Let's see what we can find.
Can I share with you a quick special story about the Amazon that's not to do with business or anything?
Do it.
Okay. So I went there once, and Dr. Duke had been there 36 times. We're on a boat, like one of these, Amazonian river boat. Oh, there was actually a little motor.
Yeah.
And the long and thin, and we're going up the Amazonian River, and we're snaking through the jungle, and I'm on a boat with like 12 people, whatever. I look to my left, and I see, forgive me if I was wrong, a jaguar, like a black, wild, exotic, feline cat, like a cat, right? Like a species of
like a panther type thing.
Panther, yes.
Yeah.
And I snap a grainy picture of it. I tell everybody to look, and as they all turn and look, it walks up into and just disappears into the forest, right? Now, the impressive part was Dr. Duke says to me, Noah, I've been here 36 times. I've spent years in the forest. I've never seen a cat. Cats don't get seen.
Right.
And I just feel like
that's a cool experience, man. That's like a
thank you, God.
Like you were chosen for that moment. That's so cool.
Whatever. I don't know.
Yeah. That's pretty cool, man. All right. Yeah. Well, okay. So as we wind down here, I think this is probably one of the longest podcasts I've done, which is that says a lot, because that means, one, our conversation's just been on point and I'm not getting bored. and 2, you're just full of amazing information. But as we wind down, I want to talk a little bit about the future of healthcare. And then right before we close, I'd like for you to tell our listeners how they can find you as well, because I think that's important. So future of healthcare, right? So there's a lot of advancements, right, in healthcare technology every day, all day, especially now with AI and robotics and all that stuff. So where do you see like the integration of tools like the microbiome testing heading in the next decade?
I just see it being the standard of care, right? So I see this being just not hard to find, difficult to talk about. Very much like women are used to getting mammograms, very much like men are used to getting prostate exams at 50, or colonoscopies, all that, right?
Got it.
So I just see it being the complete standard of care, and I will do everything I can to make sure that happens.
Got it. And then, so let's talk a little bit about so you said something about lifelong learning, like you're always kind of looking to stretch your mind and learn. Can you focus specifically on a couple of emerging, or maybe even one, whatever, emerging trends or research in your healthcare environment that you're really excited about right now?
Yeah. So, I mean, I think that, I think that the look, the genetics is emerging, right? So I dabbled in genetics like 10 years ago, and I kind of stopped because I couldn't put clinical utility to it. It was like exciting and it was fun, but I couldn't. There wasn't enough data and enough conviction to make clinical reasoning. Now there is. And I think that PGX testing is like super exciting. I don't prescribe drugs, but if I can help people have those empowered conversations with their prescribing doctors, not to be, you know, whatever, but then yeah, that's exciting. Metabolomic studies, nutrigenomics, the impact of metabolism on their physiology, the impact of nutrition on their genetics, and vice versa. The microbiome itself, man, is an emerging. When I started doing this work, there was like 6 keystone species. Now there's 9. So there's always new. It's not over. The story's being written as we speak. Yeah, it's all exciting.
Love it. I love it. So when I was introduced to chiropractic care, I was a big boy. I was a really big boy. I was probably close to 325, if not more, pounds. So I've lost 100 pounds since then, and still kind of struggling up and down. You know, I'm trying to work out. Thank you. I appreciate that. Thank you. And, you know, I'm constantly, you know, trying to keep a workout regimen, all that stuff. But I think it's more than that. I think me trying to get healthy and all that, I think a big part of it is chiropractic care. For me specifically, because of the mindset that you get after talking to your chiropractor. It almost injects and influences you in a way where you start thinking differently about your body. So what role, at least that's for me.
Thank you to your chiropractor, man. He's doing a great job.
Well, I mean, multiple chiropractors, if I'm being honest. The one that sparked the journey was played a pivotal role. But then, you know, throughout my time, you know, getting care, each chiropractor really brought a different value to the table, which I didn't leave them. It just happened that way. Like either they, whatever.
They move, you move, whatever.
Yeah. So what role do you think chiropractic care can play in addressing I'm going to throw it out there, global health challenges? Because obesity is a global health issue, right? And mental health. So what role do you think it could play in that?
That's a loaded question, man.
Yeah, I know.
So
I have those.
If we can agree that what I do is chiropractic, then that's how I see it helping, right? Because of the gut-brain axis, because of the metabolic impact on obesity and the deposition of fat. Yeah, so I think if we can agree that what I do is chiropractic, then I see the model I built and the tools that I use. I have patients outside the country, so you know, yeah. I mean, I think that that's a potential global impact, and I think chiropractic in general too, just traditional chiropractic, if you will, the adjustment. I mean, there's no technology needed. Send me to the Sahara and you know the plains in Africa, man, with my hands, and I can probably
look,
just smiling at somebody can make them happier, right?
Yeah.
So you're sending signals, and just my 2 hands in Africa, like you know, if it's appropriate and needed, like I can help people with that to be, you know, they don't have obesity problems, but maybe they have mental health, maybe there's stress, and you know, stress is good, but managing it and regulating the nervous system, that's an hour podcast in and of itself. So we'll do another one.
For sure. And here's a challenge question for you. So if you had unlimited resources to change one aspect of modern healthcare, what would you tackle first?
Easy, man. So easy. I've been preaching this for so long. I would completely annihilate the educational doctrine and the funding of medical education. I would destroy and eliminate and erase the differentiation of DC, Doctor of Chiropractic, DO, Doctor of Osteopathic Medicine, MD, medical doctor. I would just obliterate it. The funding that goes into the education of medical doctors is completely controlled by the pharmaceutical industry. So I would fund it myself. And And look, I'm not saying that I'm not biased or I would do it right, but like the Elon Musk thing, or like, I don't want to be triggering, but like Truth Social, or like just, I don't know. I would hope that I could do it right, where there would be an educational model which people are trained as physicians, and they're trained in all aspects, right? The integration, and it's not us versus them, or this versus that, or chiro or medicine, or drugs or surgery, or homeopathics, or adjustments, but that we're training physicians to be able to diagnose. Very, very important. Diagnostics is huge. And medical doctors do that really well. And sometimes chiropractors have a lot to learn from the diagnosis emphasis
Right.
of the medical profession.
Right.
Not everything, in my opinion, is a subluxation, and go ahead and define that for me. So, and I can, but whatever. And then they would utilize interventions from a non-invasive to invasive. It always blows my mind. I recently had a patient who, look, it worked out well, but her oral surgeon referred her to me because she still had jaw pain and headaches after he removed all the teeth, after he did surgery, after I saw her 3 times and she was fine after 3 years of suffering. So for what it's worth, and this guy's great. He's my patient too. I love him. People just don't know. And I don't know if it's ego. I don't know if it's business. I don't know if it's, well, they came to me, so let me try me first before I refer out. But, and I mean that globally, not me per se, but also me.
Right.
But just, like, again, you say, what makes you do cupping? Well, and I said, it's like, that's kind of invasive. Cupping causes bruising. Cupping is uncomfortable. So we try to do in an efficient manner, because time is money and everything else, and people are paying me. So I'm not going to just go through a methodology or philosophy in order to make this, happen.
Of course.
But least invasive to most invasive. So I would just completely destroy and obliterate the current model of education and the differentiation between the professions, and just create a better world.
Nice. I love it. Great answer, man. Great answer. But before we end things here, could you, for those listeners that are curious about what you do, how you can help them, what is the best way for them to reach you?
Yeah. So that's a different answer for different people, right? Individually, some people prefer email, some people prefer phones, some people prefer Instagram. I'm there all over the place.
Okay.
There are a lot of other Noah Segals. Some are actors. Dr. Noah Segals are also other doctors, and they spell the name the same way. Sometimes that works out well for me when I'm trying to get hospital records. I'm like, it's Dr. Segal. Like, what do you need, doc? And I'm like, oh, they don't realize which Dr. Segal this is. It's great.
That's great. That's great.
But I'm going to give you a couple ways. Okay. So the office phone number can be called and can be texted. That is area code 561-220-1989. 561-220-1989. I'm going to give you a website, www.ifoundwellness.com. Written the same way, no spaces, but just like I found wellness, like I find my cat or my dog outside, ifoundwellness.com. And an email is easy. It's either doc, D-O-C, or team, T-E-A-M, at drnoahsegal.com. So just like my name is spelled on the screen, but no period, right? drnoahsegal.com. So that's an email, that's a website, it's a phone number, it's a text, whatever, man. I'm not hard to find, but I may not be the person that comes up on Google.
No, that's great. That's great. Thank you for that. And I love that website, ifoundwellness.com. That's great. And you guys, you'll find his information, his URL, his phone number, his address as well. Will be wherever you're watching this. It'll be in the description. So you guys can contact him that way as well. And that's a wrap.
Wow.
On today's episode of Beyond Adjustments. I don't know about you, but I feel like I owe my gut an apology. Maybe a nice kombucha. A big thanks to Dr. Noah Segal for sharing his wisdom, his Amazon adventure stories, and reminding us that health is personal. Functional testing is powerful, and chiropractic care is way more than cracking backs. If you've loved today's episode, or just enjoyed pretending you're healthier than you actually are, do us a favor, subscribe, share, leave a review. And hey, if you've got a friend whose gut health could use a little adjustment, you know what to do. Thanks for tuning in to Beyond Adjustments, where small adjustments lead to big changes. I'm Amin Saeed, reminding you that a healthy gut is a happy gut and probably a smarter one too. We'll see you next time. Cue the music.